Hello, everyone, and welcome to the Caresify Spotlight Series, part of Caresify Health Talks, where we shine a light on caregiving, community health, and the stories that impact families every day. I'm your host, Angel Bell, CDP and Director at Caresify Home Care. Today's episode is one filled with hope. We're talking about advances in Alzheimer's research, what's changing, what's emerging, and what families should know right now as science continues to move forward. I'm honored once again to be joined by Dr. Domenico Praticò, North Star Foundation Chair in Alzheimer's Research and Professor of Neurosciences at Temple University. Dr. Praticò, thank you so much for being with us today.
Good morning, Angel, and good morning, everybody. It's such a pleasure to be back with you to continue our conversation that we started already. Conversation about topics that are so dear to me, but are so important for so many people, patient, family, on a disease such as Alzheimer's disease, that sometimes it's surrounded by a lot of inaccurate information and myths. So hopefully we can continue our conversation and try to dispel and really provide patient and family with an information that could be very useful. It's a great honor for me to be back and look forward for our second conversation.
Thank you. For families, an Alzheimer's diagnosis can feel overwhelming and sometimes hopeless. But research today looks very different than it did even a decade ago. Our goal in this conversation is to help families understand what progress is being made, what options may exist now or on the horizon, and how science is shaping the future of care. Dr. Praticò, when people hear the words Alzheimer's research, many still think progress is slow. But from your perspective, what are some of the most promising breakthroughs we're seeing today?
Well, I think today we are in a very, very good position to be cautiously optimistic because really in the last few years, we have been observing a tremendous amount of breakthrough and advancement in this field. And I just today want to take this opportunity to really talk a little bit about three major areas that I consider really a significant advancement in the field. An area that is definitely very, very important, and it's a reason for being very helpful, is the diagnostic of the disease. So the big breakthrough we have in nowadays is most importantly something related to the ability that we have today to make a diagnosis of Alzheimer's disease in a patient while the patient is still alive. Let's not forget that up to 5-6 years ago was difficult. It was almost impossible to have a diagnosis of Alzheimer's unless we would go after the patient would die and look at the brain. So the big advancement, the breakthrough I'm referring to is brain imaging. The ability we have today really to take picture of the brain in a patient, in a subject who, for example, has some memory complaint. And thanks to series of scan that we can do at the brain using what we call the positron emission tomography, or PET, we can today scan the brain of an individual and using specific radio tracer, which are compounded we can inject in the vein of a patient that can go into the brain, they can give us an exact assessment, for example, of the amount of amyloid beta plaque that's present in the brain. This is extremely important because we can have a real image of what's going on in the brain of a patient at a very early stage. So it would help a lot in early diagnosis. But beside the amyloid beta plaque, another important breakthrough in the field is the ability to do something similar also for the second type of protein that accumulate in the brain of a patient with Alzheimer's disease. In this case, we inject a radio tracer, which is a chemical that has this high affinity to bind to another protein. In this particular case, we target the tau protein. A tau is the second most important protein that deposits in the brain of a patient with Alzheimer. So the tau PET, as we call it, can give us an exact location and assessment of the amount of the fibrillary tangle, this deposit of tau protein in the brain of an individual with memory complaint. And we know that the deposit of tau, together with the deposit of amyloid beta, they well correlate with the cognitive impairment, with the memory problem. And they really can, in advance, tell us what is the trajectory of that patient. Importantly, the third part I want to mention here is we have now more sophisticated brain imaging that has been now becoming more and more in use, which is the MRI, the functional MRI. Again, another technique of brain scan and imaging that in this particular case doesn't use radiation, use magnetic field, but the functional MRI is a technique that really helps us to look at the way our brain works. And as we know, during Alzheimer's disease, one of the earliest signs is the inability of the brain to communicate between different regions. Regions are important for thinking, for execution, for ability to perform. So the functional MRI is another important breakthrough because it gives really a map of what are the areas in the brain where, if you want to use a terminology, the lighting is now reduced. But continue with the diagnosis, I just want to mention also another important breakthrough, which I'm very excited to talk about it, is that for the first time, last May in 2025, the FDA has approved the first ever blood test to measure what we call a biomarker. A biomarker is a compound that measures the disease stage, the disease development, but importantly can also measure the response that a patient has to a therapy. And this is extraordinarily important. It's a test that can be done in the blood, which, as the audience know, it's a very important step because previously we could measure the same things, but to do that we need to do a lumbar puncture, which is a much more invasive, a much more traumatic type of procedure. So this is really an enormous step forward that we are observing today in the area of the Alzheimer's disease. Another important thing is the emerging of better drug that finally now they are going to target not the symptom of a patient, the memory, but it's going to target a mechanism. And once again, we have now 2 FDA-approved drugs that can really target and clear some of the deposit of amyloid beta in the brain of the individual. And finally, the other big breakthrough is the result that we had about 6 months ago of a study who clearly show that there is up to 35% of cases of dementia could be prevented only by adopting particular lifestyle change. This is extremely important. So these are the 4 major breakthroughs that I want to share with the audience that should give us a lot of hope looking at the future with cautious optimism.
Wow. And that's encouraging to hear, especially for families who may feel stuck or discouraged. Compared to 10 or 15 years ago, how has our understanding of Alzheimer's changed in ways that truly matter for patients or caregivers?
Well, I would say that in the last 10 to 15 years, our understanding of Alzheimer has shifted from viewing is originally like 10, 15 years ago as a terminal, as a rapidly progressive type of disease, dementia, to now recognize for the first time that is a long-term biological continuum that first of all, we can detect. Second of all, we can do a diagnosis early. And for the first time, we can also have something that can manage the disease with disease-modifying therapy. But let me kind of be more systematic in the way I'm going to answer your question. For example, 10, 15 years ago, the only way, as I said, to do a diagnosis was clinical. In other words, patient would go to the doctor would do a series of tests, memory tests, cognitive tests, so forth and so on. And then there was most likely that was already an advanced state of the disease. But the final diagnosis, as I mentioned earlier, was be only after the patient would die. Today, we can have a diagnosis a very early stage, and importantly, in a patient who is still alive. What do we have today? It's what we call the biomarker or the biochemical diagnosis. So an alive patient, we can 10 years before know by measuring this compound in the blood, by doing this imaging in the brain, have a diagnosis which is accurate up to 98%, which is extraordinary. Second, another thing, 10, 15 years ago, the disease was seen as something that was nothing to do, was progressive rapidly, and was a kind of death sentence. But we know today that's not the case. We know today it's a continuum, it's a slow progressive disease that we can intervene. And that is important because from inevitable, from something that we consider impossible to do today, we have potential tool to at least slow down the disease, and that makes the life of the patient with Alzheimer's much better and prevent. Importantly, in the past, we had only the possibility to manage symptoms, which was the memory impairment. But now we have therapy that can modify the course of the disease. And finally, in the past 10, 15 years ago, when we think about the risk, there was something that we cannot do anything. We know that today we can act. We can be proactive in terms of even after diagnosis, an early diagnosis which enable early proactive care, such as utilizing new and important tool that can really make a difference. So overall, I think that compared with 10, 15 years ago, there has been a tremendous advancement with a shifted completely the view of the way we see the disease. As I said, now it's a disease that we can intervene, a disease that's any longer inevitable, any longer progressive in a way we cannot do anything. So this is extremely important that I hope the audience really is aware of this important change that we have been observing the last 10 to 15 years.
Yeah, thank you. There's been a lot of conversation around new medications, clinical trials, and families often don't know what applies to them or what is realistic. Can you help explain what treatments or clinical trials families should be aware of right now?
This is a very important topic. It's part of the shift I was mentioning earlier that we have observed in the last 2-3 years. So finally, for the last 2-3 years, we start to have available drug that go and target a mechanism that we think is important for the onset of the disease as well as for the progression. And so we have currently a lot of clinical trial that are underway in Alzheimer's disease. But I just want to focus on the major area that this therapy, which we call disease modifying and not anymore symptomatic therapy. First of all, we have a group of clinical trial that really target the major culprit, if you will, of the disease, which is the amyloid beta as well as the tau protein. As I said before, these are the two major responsible actor of the damage that we can observe in a patient that has a memory decline as well as then develop the disease. And so we have what we call this the immunotherapy. And the immunotherapy basically it's now we have two FDA approved drug which are monoclonal antibody, donanemab and lecanemab, which are now has been already shown to be effective in reducing up to 30-35% the progression of the cognitive decline in patients, which is a tremendous result. We never seen anything like this in the past with all the drugs we have available. And so we have currently different phase 3 clinical trials in phase 3, which are now targeting the amyloid plaque. And we know that patients can really benefit, particularly patients that are at the early stage of the disease, where this therapy that can be done at the moment only IV, although there is already some original research showing that a subcutaneous injection of the same can work as well. But beside the immunotherapy, another important clinical trial that we are having at the moment available is not an antibody, it's not an immunotherapy, it's a compound that is able to go into the brain and really prevent the formation of those aggregate, this kind of clump of amyloid beta that and then precipitate and induce the death of the nerve cell. This is a drug that has been now in phase 3 clinical trial. It can give orally. That's the good news for patient, for family. This is a clinical trial that is recruiting as we speak in phase 3 in different Alzheimer's centers throughout the country called ALZ 801, also Alzion. The drug that is tested, tramiprosate, is not an antibody, it's not an immunotherapy. But this has been already reported that shows a very good promise, particularly in patients with mild cognitive impairment, with, you know, it's a kind of Alzheimer's disease. And now the new clinical trial are trying to enroll people who have the mild Alzheimer's disease. But beside this clinical trial, we have also clinical trial that target the second protein, which is the tau protein. And once again, we have clinical trial using the monoclonal antibody that's going to target the accumulation of the tau protein. And there are different companies, different trials that are now starting the phase 3, which is the clinical efficacy of a drug. And these are the two important clinical trials that all the family and patient need to be aware. So these are available, and really I urge all the family really to ask the center whatever they are followed, because it's a very important moment in Alzheimer's therapy.
Thank you. Dr. Praticò, for families who may be listening right now, caregivers who are tired, scared, or even unsure of what comes next, what message of hope would you want them to take away from today's conversation?
Well, I hope that today conversation would really communicate to the audience that we have good reason to be optimistic, although cautiously optimistic, because in my opinion, the future for the Alzheimer patient and the family never looked so bright. Although we don't have a final cure for the disease, but the progress, the breakthrough that we mentioned earlier are really extraordinary. And importantly, there is much more knowledge today about the disease, how the disease progress. So more knowledge means more power, means early detection, means early decision and being proactive. And so because we know that in the last few years, we have observed a shift in the way we look at the disease. So the stigma, the myth around the disease hopefully are gone or little by little being removed. This really is very important because I think that as a community made of doctor, as scientists, as a researcher, as patient and family, we are today on the right track to win this battle. And this is a personal battle for me. It's my mission, because I always said my mission, my goal is someday we'll make memory last a lifetime.
Thank you, Dr. Praticò, for sharing your knowledge, compassion, and insight. Before we close, can you share where families and caregivers can learn more about your work, ongoing research, and trusted researches related to Alzheimer's?
Yes, absolutely. I'm at Temple University, so they can really look at the website of the School of Medicine, Temple University Alzheimer's Center, temple.edu. But another important resources, if they're interested exactly on my work and the weekly blog I write, where I try really to communicate and talk with the patient, would be the praticolab.org or drdomenicopratico.com. This is a website where there is a lot of useful information and update on the disease, but also like clinical trial, therapeutic approach, all things that people can do. But importantly, there are also websites that are more general interest that the patient and family can follow, such as the Alzheimer Association. It's a very excellent resource for many family and patient. And just to conclude, also the National Institute of Health, in particular the National Institute on Aging, has very detailed article and information for the patient. So bottom line, you are not alone. The resources out there are really abundant. It's just a matter of being proactive. And today, this should be the key for anybody, the patient as well for the family. Being proactive because today the tools available are there. It's just a matter of really taking advantage of them.
Thank you. And to our listeners, thank you for joining us for this important conversation. Advances in Alzheimer's research are happening every day. Staying informed empowers families to make thoughtful and compassionate decisions. For caregiver resources and support, visit caresify.com. We'll see you next time when we continue the conversation around advances in Alzheimer's research, and we'll talk about the role of lifestyle, which includes nutrition, social engagement, exercise, and the prevention or slowing the progression, and how technology, apps, monitoring devices, digital tools supports daily care. I'm Angel Bell, and this has been a Caresify Spotlight series, part of Caresify Health Talks. We'll see you next time.